Hello everyone, welcome to my YouTube channel Nursing Education. My name is Pinky and I am a nursing lecturer. So today I'll be discussing about respect for maternity care. Respect for maternity care had only 7 components and it was named as universal right of a child bearing woman. And then again 3 more component was added and that was related to newborn. So now it is called as the universal right of woman and newborn. Respectful maternity care is a universal human right, and every woman and newborn in every healthcare system around the world have the right. And that right includes respect for women's autonomy, dignity, feeling, choice, and preference, including companionship during a maternity care. So, as I mentioned, that there are 10 components of respectful maternity care. So, I'll discuss one by one. First component of respectful maternity care is everyone has right to free from harm and ill treatment. So all type of physical contact with a pregnant woman should be gentle, comforting and supporting as possible. And no one is allowed to physically hurt a woman and the newborn and both should be taken care of in a gentle and the comforting way and receive the assistance whenever a man is experiencing pain or discomfort during a labor and after the labor. Despite the right of freedom from harm and ill treatment, many evidence of the physical abuse has been reported all over the world. An example of physical abuse during the childbirth are from a pinching by the service provider to the sexual abuse. And other kind of physical abuse are slapped, restraint during the labor, application of unnecessary episiotomy when episiotomy doesn't require, and the suturing without the use of anesthesia and pushing on the abdomen to the force the baby out. So this kind of physical abuse should be avoided whenever as a nurse we are carrying the woman and their newborn. Second component is everyone has the right to information, informed consent and refusal and respect for a choice and preference including companionship during maternity care. So here you can see that many women experience unconsented procedure like cesarean section, episiotomy and induction of labor. So no one is allowed to force or do things to the woman and her newborn without her knowledge or the consent. And every woman has right to autonomy and to receive information from the healthcare worker or from the nurse or from the doctor. And as a nurse you have right to provide information to the woman and get her informed consent. And as women also have a right to refuse the care if she don't want to involve in the care. And women should not be forced to do the things without information or informed consent. As a nurse you have to explain each and everything regarding the procedure in the understandable language is necessary to make them understand and to provide the care to the woman. And also every parent or the guardian or the mother has right to receive information about the newborn, and she also have a right to refuse the treatment or the care about the newborn. And as a nurse we have to also be responsible of the woman's choices if she want to keep the companion or if she want her husband to be with her or her mother to be with her during a treatment or during a maternity care. Your responsibility is to be taken care of her choice. Third one is everyone has the right to privacy and confidentiality. So healthcare provider must protect the privacy and confidentiality during a counseling, physical examination to the woman, clinical procedure, and while handling record and information of the woman. And no one is allowed to share newborn personal or medical information, including all the record and image, without the woman or the parent consent. And that is some example of the violation of privacy and confidentiality are delivering baby without a privacy and sharing a sensitive information such as marital status, HIV status, and medical history of the woman. So this should not be done to protect the woman right to privacy and confidentiality. Next one is everyone is there one person from the moment of the birth has the right to be treated with a dignity and respect. So no one is allowed to humiliate, verbally abuse, speak about or toss the mother or newborn in a disrespect manner. Woman and the newborn baby must be cared with respect and compassion. and they should be encouraged to express their idea of feeling freely and provide a feedback to the service provider if they feel this is not appropriate kinds of care and this is not appropriate way to providing care. So they have right to provide feedback, and you have to take that feedback in a positive manner as a nurse. And the care provider must be ensure the patient as comfortable as possible during procedure. Every woman must be treated with respect and concern. So, women perception and the description of the non-dignified or disrespect care may be very contextual, specified, because a woman may be perceive eye contact like a smile and the handshake from a male provider as acceptable in one culture, but that cannot be same to the another culture. So that might be negative, or that the woman might take in different way in the another culture. So whenever you are as a nurse, you are providing care to the woman, you have to understand their culture, what exactly their culture accept, or what their culture is, and based on that you have to provide care to the woman with a respect and dignified way. Fifth component of respectful maternity care is everyone has right to equality, freedom from discrimination, and equitable care. So no one is allowed to discriminate women and their newborn. Equality requires that pregnant women have the same level of protection under the law as they would when they are not pregnant, including the right to make a decision about their treatment, about their body, what happened to their body, and about the treatment. And no one can discriminate because of something they do not like about the pregnant woman. And all the women should be taken care equal and should be provided care equally, and it must be treated with respect, care, regardless of their ethnic group or background, and regardless of their culture, social standard, education level, and economical status. And we should not discriminate the woman because of their background, and we should provide the care to the woman equally. Another component of respectful maternity care is everyone has right to health care and to the highest attainable level of the health care. So no one may prevent the woman and her newborn from getting the health care needed, or deny or withhold care from either of them. And woman and her newborn have a right to the highest quality of a care, and that should be provided in a timely manner in a clean and safe environment by the provider who are trained in a train-based practice. And a woman who is going to give birth should never be left alone. One of the staff or nurse or midwife should always be with her and throughout the maternity care. And women should have a companion of their choice throughout the labor birth and for the continuous support. If the woman wants her husband to keep with her or the mother to keep with her throughout the maternity care, she have right to do that. And as a nurse, you have to support her with her decision. Seventh component is everyone has right to liberty, autonomy, self-determination, and freedom from arbitrary detention. No one is allowed to detain a woman and her newborn in healthcare facility even if they cannot pay for her service they receive and the treatment they receive. But some facilities are known to be prevent women from living with their babies because they cannot pay their bill, and there is only for a day or two. But there are the reported of patients being held for a week and month. Even women whose babies died has been detained because they could not pay their bills. So this should not be done by the healthcare provider or the healthcare facility. Women have right to freedom, and she can leave the healthcare facility whenever she wants and whenever she have completed her treatment. Another component is every child has right to be with their parent and guardian. So no one is allowed to separate the woman from her newborn baby without the woman consent. And the woman and the newborn have right to be remain together at all the time, even if the newborn is born small, premature, or with a medical condition that requires extra care. But if the mother doesn't want to separate with her newborn and want to keep a newborn together, she has right to do that. And if you want to provide care to the newborn, as if the newborn require extra care, we have to get a consent from the mother. If she want to give a consent, then only we can separate mother from a newborn to provide extra care to the baby. So next component is every child has right to an identity and nationality from the birth. So no one is allowed to deny the newborn birth registration after their birth, and even they die shortly after the birth. Or no one is allowed to deny the nationality of the newborn is legally entitled to, and they have right to get their identity and nationality from the birth. Last component is everyone has the right to adequate nutrition and the clean water. So no one is allowed to prevent the woman and their newborn from having adequate nutrition and clean water and healthy environment. So women have right to get information regarding the nutrition during a pregnancy and during breastfeeding, and also the support on the child nutrition and the advantage of the breastfeeding to the baby. So thank you for watching. Please like the video, subscribe my channel and press the bell icon to get a more video.